Hey, good morning, everyone. It's Friday, the 17th of July. It's going to be a fantastic day today, so keep hydrated. The first thing that I've wanted to just tell colleagues about really is some of you might have seen a text message or an email going around that talks about sort of a small increase in COVID-19 cases in the NW11 area. You might have been circulated that message. It is genuine. First of all, I think I wanted to let you know. And I think what I understand is obviously is that there has been a small increase in cases in the NW11 area. So I know that there is a borough campaign launched by Public Health Barnet. So we're waiting to hear some more information from our public health directors, and hopefully we can get an update on you for that next week. So I'll keep you posted if I hear any more information. But just to say that it was a genuine message that you might have received. Today's webinar, I really wanted to focus on two things. One is the COVID risk assessment for primary care teams and community services, which is quite a big topic. So I'm going to be sharing my screen for this part of the session, just so you can see what I can see this morning. So hopefully in a moment, everyone will be able to see my screen. That should now pop up on the screen. So we are recommending, and certainly NCL is, that all staff and practices should have a risk assessment tool done. And this is available online. Most of you would have already seen it, but I'm sharing it here with you, and I'll make it available at the end of the webinar as well on the chat bar as a Word document that you can have. So we recommend scoring members of staff with these scores, and then according to the sort of scores, you will then sort of pick whether they're in sort of a low risk, high risk, or very high risk. And in primary care, it might be that, if they're very high risk, they'll be working from home, or continuing with caution or having modified duties. But certainly, when we say enhanced PPE, this really means that they might be wearing face coverings at all times. Really, we should be wearing a PPE for even cold patients, if I'm being honest. And certainly, I think most of our colleagues are doing that anyway, or for like baby imms and things like that. Now, there are lots of different scores available online, and this is the particular one that NCL has been using, and it's available on the NCL website as well. So I just thought I'd mention that. I'm just going to, the next thing I wanted to talk about was phlebotomy, and really that Finchley is running at full capacity now. And so the numbers are the activity numbers are pre-COVID, so they've got capacity for about 800 blood tests a week. And Edgware is due to restart on Monday, Edgware Community Hospital. I wanted to remind colleagues that we've been putting urgent on forms quite a lot recently. And what I'm going to ask you to kindly do, and I really want you to spread the word here, is that if you have an urgent blood test, genuinely urgent, put urgent on it. Otherwise, if it's not urgent, use the word essential, and that's the word essential on the form, and that will still get done. But what happens is they'll do two things. When the patient goes to book the blood test, let's say they book it at sort of 1 o'clock in the afternoon and it's pretty full for that day, they won't be booked in as an extra because it's not urgent. And that's one thing that allows sort of prioritization of work. And the second thing is when it hits the lab, they actually look at what it says on the clinical details, believe it or not, and they're really struggling because everything says urgent at the moment. So they're trying to process everything within 24 hours, and it's causing havoc in the lab. So please just use those two references. And the real important thing I wanted to let you know about is domiciliary phlebotomy. So we looked at data from April to June 2019. And across the borough, we referred in that period about 1,000 cases to have a domiciliary phlebotomy done. And in the same period this year, we've had 2,500 cases. So really a big surge. So I recognise that a lot of people are probably shielding at the moment, and they're technically housebound, and that might be the reason for the surge, but it's really, really impacting the service. And they've got lots of staff brought in from the walk-in centre and other areas to try and cope with the surge, but still struggling. So routine domiciliary phlebotomy, the waiting time is between 2 days and 5 weeks, really depending on whether you put urgent or routine on there. And that's because of that demand. And we are monitoring that closely at the CCG as well. The final thing I just want to remind you about is EPS4. I've mentioned this before, so do get sorted out with that if you haven't done already. Right, the most important thing about today I wanted to talk to you about was community services update, and hopefully everyone can see my screen. I'm just going to talk about every single community service at the moment and go through it as to where it is. So if you look at the status colours, red stands for not open or not really open at the moment, amber is open but reduced capacity or performance, and green is sort of moving at pre-COVID capacity and performance. So the bladder and bowel sort of service is going at amber at the moment. So they're offering virtual consultations and home visits, and they are putting more appointments on as well. The COPD service again is offering virtual consultations and home visits as well, and the same with the diabetes one and the heart function or heart improvement service. Okay. Inpatients, as you know from CLCH, are running at green, and they always have been. So we've got the wards on in Edgware and Finchley that have always been open. So they're going at a green. The learning disabilities team, again, have always been open through the pandemic, and they're running at a green. So they're doing home visits for patients at the moment because we think they're high risk, and they're shielding, and they're offering virtual consultations, so on the phone and other platforms as well. Now, the biggest one people probably want to know about is MSK and physio. Now, I would like to tell you that from Monday, we can start re-referring back into physio and MSK, which is great news. And you can do that via RMS if it's for MSK, or directly to physiotherapy via the email address that we've been using pre-COVID. Now, there is going to be some innovation here, really. We're talking to CLCH about what they can do differently. And they've already started offering virtual consultations to those in the backlog. But really, we're talking about whether they can do large virtual consultations in groups, sort of online exercises and direction to online material as well. So really looking for an innovative redesign of the service in view of COVID-19 pandemic. So great news, you can start re-referring back from Monday. Nutrition support, again, is an amber. They're doing online and virtual. And the one care home team is the InReach model that's going at green to provide support for care home residents. Orthotics is an amber. Parkinson's is an amber. So that's really so that you know that. The phlebotomy I've talked about already. The planned care team, which is the district nurses and things, they're all been running already. Podiatric surgery is not running; it's on hold, and that's not just across our community service. That's the same in the acute trust at the Royal Free and Barnet, according to national guidance. But the actual podiatry services are running and have actually been running through the pandemic, offering video consultations, as some of you will be aware of. Stroke is a green, tissue viability is amber, and unplanned, which is rapid response, is a green. The walk-in centres, only Finchley is opening as a minor injuries unit, and as we already know, Edgware Community Hospital remains closed, and the Advanced Assessment Hub, or the HOT Hub, is in that place. Children's services, finally, healthy child clinics. So that's not currently running in line with national guidance, but what is very important, they've redeployed staff into the health visiting. So the mandated checks, it's the new birth visit, the 6 to 8 week, and the 1 to 2 year old review, they're all going ahead. Antenatal groups, they're offering something group online virtual and webinars, but nothing sort of antenatal visiting service, because large numbers of women, high risk at the moment. School nursing, they're supporting sort of safeguarding and schools with ICP at the moment, given that lots of schools aren't open. And orthoptics is just urgent care. And then finally, the really important things that you would expect to be green are the looked after children, safeguarding, the children's complex care team, and the special school nursing and nutrition and dietetics are all open as green. So I'm going to go to the chat bar. If you want to ask me any questions, feel free to. So I'm going to go to the chat bar. So I've got, Ogie, you've got issues with phlebotomy as massive workload dumping we are seeing from hospital, where we're asking us to do bloods. Yeah, I really agree with that. And what I'm going to suggest, if that's an issue, please do email the CCG quality team. Please don't include any patient identifiable information in that email, but you could remove the PID from the clinic letter, and send it to the quality team at the CCG, because absolutely there should not be a dumping from secondary care into primary care. And if you are being asked to do work that you think is inappropriate, we should be feeding that back to the trust or the quality team. Cavil's asked a question about waiting times. Absolutely right. So this table is just being finalised and will be ready for next week. And it will have a tab that says waiting lists. So I'm just waiting for that. It will be in next Friday's bulletin with the waiting times on it, and it will be published in next Friday's bulletin and then available on the intranet from next Friday, that table with waiting times. So I can give you a final copy of it next Friday, and I'll share it with you in next Friday's or even maybe Tuesday's webinar if it's ready by then with the waiting times. Are there any other questions from colleagues at all, or anything anyone wants to let me know about, any feedback? If there is anything that you remember afterwards, you can always put it in the chat bar and I can answer it on Tuesday. Okay, everyone. Well, thanks very much. I've got one more question from Lyndon. Major concerns re antenatal care and health visiting input after birth, seriously ill children being missed. No, I don't know anything about that. It's not an area that I look after, but really, if you could give me an example, Lyndon, I'd really appreciate it. I'm sure that we could feed it to the quality team and I can find out who looks after that area. If it's the actual service, I know the service manager for CLCH children's and antenatal, so maybe I could feed it back to them. So if you could just drop me an email with exactly what happened, I can feed it back to the right person. Okay, everyone, thank you very much for joining me this morning. Have a fantastic weekend, and I'll see you all on Tuesday.
Thank you.